I would like to begin here in this webinar. And just my name is Hans Pulver. I'm coming from the company Asclepion, and I'm responsible for Middle East, African countries, and some South Asian countries. Today, we want to listen to Professor Essam, which is here on the screen as well. And it's my pleasure to have him with us. He's from Egypt. He's the Dean of the Faculty of Medicine and Professor of the Dermatology and Andrology. And thank you very much for giving us your time, and thank you very much for joining us here. And it's our pleasure to have you with us. I will start with some information and some organization. How do we do this? At first, I would like to say some words regarding the machine, just a few slides, I think 9 slides, and a little bit about the company. Then we are happy to listen to Professor Essam regarding the vascular and non-vascular application of the QuadroStarPRO YELLOW. Between this, I think we make 1 or maximum 2 stops for just 1 question or 2 questions, let's see. But then in the end of the presentation, we should go and we should go ahead with a few question and answers. And I think Professor is ready to do this. If you want to place questions, there's a button on the dashboard where you can put the question in or even in the chat. And my colleague Jessica, who's in the background, will a little bit handle this and inform me, or she will give the question then to Professor. And I think this is a good opportunity to listen also what are the questions in the field. The participants, the listener of this, they are with the microphone is silent, and we can switch it off, but usually it's silent and you cannot talk. But if necessary, sure, you can also raise the hand on the dashboard in order to announce that you have something to say, and the Jessica will handle this there in the background and help us here. I try to be clear with the organization, so whenever we switch the microphone to Professor Essam, or so that I will say we switch there or we go now to another participant in order to have a good organization there. Yes, we clarified the question so far. However, if somebody has a question regarding the transmission of the audio or video, send it in the chat or in the Fragen, in the questions. Sorry, German. And my colleague can try to handle this or gives you a quick answer. So now, if you allow me, I start just with some words regarding the machine itself. It's not so long, so the main activities comes then from Professor Essam, and please allow me to start with some slides here in advance, but I think it's also very important. Okay. Maybe do you see the picture what I have now on the screen, just to make sure? Professor Essam, do you see it? Or Jessica?
Yes, I can see it.
Okay, so then I can go ahead even to transmit this to all the people which are now participating. So we are doing Academy, and this is a part of the Academy from our company. There is a long history since a lot of years already, and now actually we are even improved the Academy and the exchange of information. There are a lot of steps between, but 2019, in the end of the year, we opened a new building. And this building, actually, you see on the right hand side, the huge building is actually made for our guests, for our doctors, for our also representatives. Just to make sure that you know, this is our company with the administration building. This is the production hall, quite big with the extension as well. And company invested a lot in this nice building, and we listen all the time to the words of the management that this building is for us and this building is for the doctors. And we have really the feeling, and we somehow are really proud to have such nice condition there. We have training rooms. We can host up to 100, 120 people. We have 3 treatment rooms, and this is made for inviting guests and listen to the trainings here. Important is that we work together with the university in Germany, in Jena here, with a dermatology department, and it is not the presentation maybe as usual with the commercial background. No, this is the medical background, and background which is very useful for the doctors which are coming here, and even in the end the certificate has a good value in the world because it's coming from a real scientific medical department. So we like to be here. All this level is for the training, and upstairs we are even able to drink a cup of coffee, to have talk to each other, so that we have also the good relationship to our doctors. Actually, we enjoy this new building, even if the situation is a little bit unusual at the moment because of this virus. Okay, but today we talk about the state-of-the-art tabletop laser QuadroStarPRO YELLOw, and I go to a few slides or to few points of the history. You see that we started with such laser even in 1984. So we passed different experience. So we also had already a very bulky machine in 2001, the copper bromide laser. But of course, the development goes ahead to a more tabletop machine, which ends in the QuadroStarPRO YELLOw. So you see that there are still a difference even in the size, in the capacity, in the features of such a machine, but this will be a point a little bit later on. Here you see this is a tabletop machine which works with wavelengths of 577, and we have 5 to 5 watts available with the 577. We can do different modi. We can also do in a continuous wave mode. We are working in the pulse mode very fast. The machine is quite small, so that we even can transport this to different locations. And we have different handpieces, but I think even Professor Essam will say something regarding the handpiece, in which application he is using which handpiece. Actually, we have the standard handpiece like a pen, and of course different sizes and even a scanner. With a scanner, you can use a bigger area. Also depends on the application, and we can also supply different shapes in order to catch maybe a certain bigger area, and this is a benefit with and compared to a normal handpiece. And very important, integrated cooling system, which allows to cool the treated area very well. Even the machine can be transported, and we have this experience that this makes also a good sense, and in some cases they even go to different places and use the machine there. This machine works on a technology. It's a high power optical pumped semiconductor laser. What does it mean? This is a very clever technology and allows to do every wavelength what you need. Of course, the company has to decide which wavelengths do we want to present. We presenting the 577, which is the highest point of oxyhemoglobin absorption. So a semiconductor piece is really a stable thing, and this is the benefit of such a machine, to switch it on and to switch it on in the morning and switch it off in the evening, because it's really a solid, no really big adjustments or whatever has to be done, and of course no running costs except a little bit ultrasound gel, which is good to have a good optical contact and cooling contact there. Where do we go? You know this curve anyway, but here in the oxyhemoglobin maximum point, we have the 577. So we have a good point, and the curve here, the physics, let's say it's important that we know where are the maximum points. Here in this case, you have 577, and the most absorption will take place in oxyhemoglobin here, and the melanin is a little bit less. So that means we have a good access to the vascular lesion, and with a low absorption water and the low absorption or low scattering impact. So this seems to be a very, very beneficial wavelengths. And I know from the other machines in the past, a lot of doctors which I'm talking to are knowing already the laser with the yellow light, but the costs for such machine were much too high, so they changed to other machines. But now with this technology, you have a tool in your hand which supply the 577, no consumer cost, no consumable costs, which is a big benefit. And I think Professor Essam also will mention this again, compared to 532, the 577 has much better absorption in the blood. That means we have even 40% more absorption. We have lower melanin absorption. We have fewer side effects, less fluence required. This is also important, that we do not have to have such a big amount of energy, and we have good results in different applications, which of course will Professor talk about. There are a lot of studies, a lot of papers. Also, Professor Essam did papers, and I think he will mention this also in his presentation. And he talks about these things what he got. Such studies are available in our study book, and in the end, maybe you can also ask or send an email to us in order to order this information. So I suggest to have the questions also maybe in the end, so that we can work on this question maybe here, or you send it by email in order to answer you then very reliable. So this is my short presentation, and I think it is not too long. And now the next point, we should switch over to Professor Essam. So it's your turn now.
Okay. Today we will talk about vascular and non-vascular application, QuadroStarPRO YELLOw laser. I am Dr. Essam Mohammed, Professor of Dermatology and the current Dean of Faculty of Medicine at Azhar University from Egypt. My first question, what is the most important indication of laser? I think hair reduction and the vascular treatment of vascular lesions is only laser represents the main line of treatment. You can't treat hirsutism without laser, and you can't treat vascular lesion without laser. When you think to vascular lesions, which vascular laser machine you prefer? We have three options: pulsed dye, QuadroStar, and copper bromide. Pulsed dye is a famous machine, but need consumers every few months. You need to change the dye every few months, and this is will increase the cost on the center and the patient. Copper bromide, with a small spot size, not suitable for large lesions, and hence we decide to take QuadroStarPRO for our unit. What's QuadroStarPRO YELLOw laser? QuadroStarPRO YELLOw laser is a diode laser with 577 nanometer wavelengths. As my dear friend Hans say, this wavelengths show high absorption of oxyhemoglobin, so it's effective in vascular and pigmented lesions. Also, absorption of this wavelength by oxyhemoglobin exceeds that of 532 by about 40%. QuadroStar has two modes. The first mode is 1 millimeter spot size. The second mode is scanner mode. Each mode has different parameter, different shape, different size, allow us to treat all lesions, whatever its size or its shape. The mechanism of action of QuadroStarPRO, 3 types of mechanisms. Each type of mechanism is useful in some diseases. The first common type is photothermal effect. Our target here, oxyhemoglobin, deoxyhemoglobin, and melanin. So it's effective in vascular and pigmental skin disease. You can treat vascular and pigmental skin disease through photothermal effect. Another mode of mechanism of action is the photochemical effect. What is the meaning of photochemical effect? Photochemical effect, as we know, some lesions like acne contain Propionibacterium acne. Propionibacterium acne produce porphyrin, which is absorbed by laser light and resulting in release of reactive oxygen species. This reactive oxygen species will kill the bacteria. So photochemical mode of action is an important mode of action in treatment of inflammatory disease like acne, onychomycosis, and so on. The third mechanism of action is surgical. QuadroStar has a surgical mode, can act as surgical CO2. You can remove tumors, whatever it's benign tumor, vascular tumor, and so on, by this mode of action. What are the clinical applications of QuadroStarPRO? According to the mechanism of action, there are main indications for QuadroStar. The first indication is the vascular diseases. Second indication is non-vascular diseases. And third indication is skin tumors. Example of these indications, vascular diseases. QuadroStar can treat facial erythema, facial telangiectasia, hemangiomas, port wine stains, spider angiomas, rosacea, and other diseases like equinoderma, pyogenic granuloma, cherry angioma, or leg veins. The most important non-vascular treatment is the pigmented disorders like solar lentigen, melasma, and post-inflammatory hyperpigmentation. All of these indications can be treated by QuadroStarPRO, as we say later on in the clinical trials. Benign tumors like fibroma, angiofibroma, angiokeratoma, and warts also can be treated by QuadroStarPRO. If you have lesion like wart, angiokeratoma, angiofibroma, you can treat it, and we will discuss the mode how to treat it. One asked me, what is the top indication of QuadroStarPRO release? It's a good question. When I have laser machine, laser is a machine, and doctor who working with the machine, you must select the patient, you must select the indication, and you must select the proper parameter to get a benefit from the machine. I think, from my opinion, there is a first study published about successful treatment of facial vascular skin diseases with 577 nanometer Pro YELLOW laser. We published it in 2018. The first indication, vascular lesion like facial erythema. Facial erythema, one of the most excellent result by QuadroStarPRO. How to treat facial erythema by QuadroStarPRO? At first, you must adjust the parameter. You must select short wavelengths. You must select low fluence. Short wavelengths, already we have 577 nanometer. The fluence is low in facial erythema. You can start by 12 joules up to 16 joules. And the short pulse duration, and marvelous result will obtain from 1 to 3 sessions maximum. This patient treated by QuadroStarPRO, I think has excellent improvement after only 2 sessions. We start 12 joules and increase to 14 in the second session. The pulse duration adjusted according to the parameter by the machine from 20 to 26 milliseconds. Another patient with facial erythema also received 2 sessions from QuadroStarPRO and get excellent result, 100% improvement completely. In this patient, we start to compare QuadroStarPRO with IPL. The right side treated by QuadroStarPRO and the left side treated by IPL, and they give excellent result, 100% improvement after 4 sessions by scanner mode, fluence from 18 to 16, 12 to 16, and the pulse duration from 20 to 27. I think in facial erythema is an important indication for laser because they receive less sessions and they get more improvement up to 100%. Why acne? Acne is a non-vascular disease. Why acne in QuadroStarPRO? When we start to treat acne by QuadroStarPRO, we say in the literature the efficacy of acne by copper bromide and pulsed dye laser. So we decide to treat acne with QuadroStarPRO. At first, we didn't know what is the result, as it's non-vascular disease. So we start to treat acne vascular form. We did 3 sessions, 2 weeks apart. We select the parameter as vascular parameters from 18 to 21 fluence, from 28 to 32 pulse duration, and use scanner mode and only single pass. We try to compare the treatment with laser, QuadroStar especially, by topical antibiotic. How QuadroStar acted? Photochemical effect, killing propylbacterium acne through the oxidative reaction. Also, QuadroStar had a thermal effect on the species gland microvasculature. There is dual mechanism of action. Photochemical, propylbacterium acne release porphyrin absorbed by laser light, release ROS, or active oxygen species, reactive oxygen species killing the bacteria. One mechanism. Another mechanism, photothermal on the species gland microvasculature. This case of acne, the left side treated by laser, the right side treated by systemic topical antibiotic. After 3 sessions, 2 weeks apart, there is near complete improvement in the laser treated side and partial improvement in the right side, non-laser treated side. But the efficacy of QuadroStarPRO in acne, not only in vascular. The most important effect of QuadroStar in acne is severe form of acne, like nodulocystic acne. Another case of vascular acne, the left side blue treated by laser. After 3 sessions, near complete improvement. The right side, non-laser treated side, partial improvement. But the marvelous result, in my opinion, get in this case, nodulocystic acne. Nodulocystic acne is a recalcitrant disease. The first indication is isotretinoin. Isotretinoin is effective but has several limitations. So if QuadroStarPRO gives a result, it will be another choice more than isotretinoin. The left side treated by QuadroStar and the right side treated only by topical antibiotic. I think the difference is clear. The left side improves significantly, while the right side is still complaining from nodulocystic. The parameter used, fluence 18 and increased to 21 after 3 sessions. We take 3 sessions, 2 weeks interval. Coverage, it's better to do 80% coverage. Why? To allow renewal of skin in between, like what we do in fractional laser. The pulse duration starts from 30 to 32. Pulse duration is better to increase with photo skin type or dark skin type. Most of our patient skin types 4 or 5, so pulse duration it's better to be prolonged. And we use scanner mode. After 3 sessions, improvement to occur after this. This patient received 3 sessions also, 2 weeks apart. The upper right one is the first session. The left right upper one is the second session. Below the left one is the third session, and the left lower one is the third session. Sorry. I think it's a complete improvement of acne, and also there is a clearance of post-inflammatory hyperpigmentation. It's a good result to obtain in about 1.5 months. Only 3 sessions gave us an improvement significantly like this. So I consider that acne one of the most important indication due to prevalence of acne. Acne represents a major section in the dermatological clinic, and also the result obtained by laser. If you collect these 2 factors, you will select acne as the most important indication for QuadroStarPRO YELLOw laser. Rosacea. Rosacea is a disease characterized by papules, pustule, telangiectasia, erythema, and flushing. And it is a chronic disease and recalcitrant to many treatment. And as you know, it's difficult to treat. What can QuadroStarPRO work in rosacea? Rosacea, one of the highly treatable disease by QuadroStarPRO. This case, rosacea received 3 sessions. We start by 14 June, increase to 16 in the second session, and 18 in the last session, and the complete improvement occurred after 3 sessions. The result of rosacea, like result of facial erythema and acne, occurs only after 2 to 3 sessions only. Occur with a short time, 1.5 months, we should complete clearance of the lesion. Also, rosacea, we select pulse duration, short pulse duration from 20 to 20 seconds. Another case with rosacea improves significantly after 3 sessions at the same parameter. Rosacea is an important indication in QuadroStarPRO. If marvelous result in a short time. Telangiectasia, one of the most common cosmetic problem. Telangiectasia treatment by laser depends on many factors. Age of the patient, I think a younger age is a better prognosis. Site of the lesion, if we select facial telangiectasia, is there a difference in treatment between facial telangiectasia in the cheek or in the nose? Which better, in the cheek or in the nose? Yes, on the cheek is a better prognosis than on the nose. The depth of blood vessels. Depth of blood vessel is an important parameter. So superficial blood vessels can be treated by superficial laser like QuadroStarPRO, while deep blood vessels need longer wavelengths like NDA. The diameter of blood vessels will adjust the pulse duration according to the diameter. Short pulse in smaller diameter, longer pulse duration in larger diameter. Skin phototype is an important factor in laser treatment as general. Skin phototype 3, 4, 5. Many factors will be adjusted according to skin type. When we treat telangiectasia in Egypt, we start by 18 June. In Turkish, start by 28 June. In skin phototype, dark skin phototype, we select low fluence and short and longer pulse duration. Usually, telangiectasia improved from 1 to 3 sessions only. This case received 3 sessions, start from 18 to 21 June, and pulse duration from 24 to 26, and improved completely. Another case improved significantly, not completely, because the nasal telangiectasia is more resistant to treatment than cheek telangiectasia. Cheek telangiectasia is a good prognostic factor for treatment. After 2 sessions only by scanner mode. In telangiectasia, you can select 1 millimeter spot size mode only, tuck, 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 or you can scanner mode all over the face without selection of telangiectasia. Another case of telangiectasia. Also, another case of telangiectasia. The right side. This is telangiectatic vessels improved after laser, and this is the dermoscopic criteria before and after laser treatment. So we can select facial erythema, facial telangiectasia, papulopustular rosacea, acne from the highly treatable disease by QuadroStarPRO. Melasma. Melasma is a common problem. Melasma acquired hyperpigmentation in the cheek, forehead. There is genetically susceptibility to melasma increased by sun exposure. What's the problem of melasma? Is it the treatment or the recurrence? I think most of cases of melasma respond to treatment, but 100% of cases of melasma will be recurred again. Okay. What's the role of vascular laser in melasma? The first literature in 2007 about the vascular characteristic of melasma by Kim et al. They enumerate the link between melanocyte and blood vessels. Kim et al. Said that human melanocyte may respond to angiogenic factors because normal human melanocyte express vascular endothelial growth factor receptors. That means that the melanocyte controlled by blood vessels. The vascular endothelial growth factor significantly increase at vaginal epidermis of melasma compared with pre-vaginal normal skin. Lee et al. 2010 treatment of melasma with carbamide laser 578 nanometer result in decreased number and size of blood vessel and decreased vascular endothelial growth factor immunoactivity. The link of melanin and blood vessels was discovered by Kim and confirmed by Lee. This is our study about melasma published in 2020. Efficacy of 577 nanometer pro yellow laser in the treatment of melasma, a prospective split face study. This case of melasma, one side treated by laser and other side treated by hydroquinone. After 3 months, there is complete improvement in both sides. But what after 6 months? What's occurred? There's marked recurrence occurred in hydroquinone treated side and minimize recurrence in laser treated side. So if we return to our study, we concluded in our study that addition of 577 nanometer pro yellow laser in the treatment of melasma lead to maintain the improvement and reduce the recurrence rate. This is our aim in melasma. When we use QuadroStarPRO in melasma, we use it to maintain improvement and to minimize recurrence. Like this case, recurrence occur in non-laser treated site and minimize the recurrence in laser treated site. Another patient treated by hydroquinone plus laser, improvement on both sides, but after follow-up 6 months, the recurrence occur in non-laser treated site and the laser site show minimal recurrence, even no recurrence occur. And it's important factor, important item you must know in the treatment of melasma by QuadroStarPRO. You didn't need to treat it as hydroquinone can do it. You need to maximize the effect of medical treatment and also minimize the recurrence rate, which is an important factor in the treatment of melasma. Another indication in QuadroStarPRO is port wine stain. Port wine stain is a vascular disease. Resistance treatment has no treatment except laser. A patient come to clinic need to remove this stain. You must suspect what's patient expectation about treatment. At first, how many sessions can be used to treat port wine stain? Port wine stain needs 6 or more treatment sessions. Another items, all sides treated as the same side. Cheek like the nose, like the chin, like the forehead. No. Port wine stain in certain location like medical cheek, upper lip, distal extremities need additional treatment and they may have incomplete clearance. I think this results by QuadroStar is an excellent result. Complete clearance or near complete clearance of port wine stain in 7 sessions. We select scanner mode. Fluence started by 17 and increase every session by 1 up to 20 and then stop. Pulse duration, longer pulse duration is needed from 30 to 32 milliseconds. Another patient with satisfied improvement of port wine stain, but after 10 treatment sessions. We can stop here to take some questions and we again. Hemangioma is actually self-limited disease. It disappears completely from 2 to 3 years. But some infant and children coming to clinic complaining from complication of hemangioma, like bleeding, excessive bleeding. In this case, we select laser 1 session or 2 sessions to stop bleeding and improve hemangioma. We find an excellent result after 1 or 2 sessions with fluence by hemangioma. This case is treated by 1 session only and nearly improved. But we didn't use it regularly, except in case of complication. If there's bleeding, is recurrent trauma, you can use laser. Otherwise, it's better to avoid only self-limited disease only. Another case complaining from frequent bleeding from angioma, treated by 2 sessions and improved significantly, at least bleeding stop by low fluence, 12 joule per square centimeter. This case show combination of superficial lesion and deep lesion. 577 has a limited penetration power to papillary dermis, so the erythema disappear, but the dermal vasculature still has it. Another case of angiomas, all of them are treated to avoid complications like excessive bleeding. This case of angiobiogenic granuloma. Biogenic granuloma is a vascular tumor. Patient complaining from recurrent bleeding everywhere. Has 2 components, superficial component and deep component. In this case, we remove the superficial part by continuous mode of 1 millimeter spot size probe, and the deep part we treat it by expert mode of 1 millimeter spot size probe. About 4 sessions, the patient near complete and continue receive session till now, but this after 4 sessions only. Superficial part completely improved, the deeper part improved significantly, and the bleeding stopped. Most of the complication or complaint of the patient improved after 4 session treatment. Angiofibroma, one of the most resistant treatment, has no drug treatment, only laser treatment. You can use CO2 or QuadroStarPRO. Here, QuadroStarPRO can replace CO2 in treatment of angiofibroma. You select 1 millimeter spot size probe, expert and continuous mode. What is the meaning of expert and continuous mode? We can remove it like a surgical CO2 if it's large like this. If it's small, we can do it by expert mode only. Joules started from 23 to 28 and a significant improvement after 4 to 6 sessions of care. This is the dermoscopic feature of lesion of angiofibroma improve significantly after 4 to 6 sessions. Another case is a cosmetic problem, angiofibroma of the face. This is a cosmetic problem, and the patient complaining from it. Treated by QuadroStarPRO, about 4 sessions, and improved significantly. Here we use expert mode. If we use continuous mode, we will result in hyperpigmentation or scarring. It's better to do expert mode and take more sessions of better than surgical treatment. Wart is a benign tumor, common benign tumor, can be treated by many lesions. We acted on QuadroStarPRO. QuadroStarPRO can improve wart through photothermal effect, through the obliteration of nutrient supply to the wart, or thermal energy to heat sensitive human papillomavirus. This is the two mechanisms of action of wart by QuadroStarPRO. This is a case of wart in the ear treated by QuadroStarPRO, improved completely. This immediate finding after treatment of plain wart. You can treat a plain wart without bleeding at all. This is immediately after improvement, after session. Fibrokeratoma, it's a benign tumor, contain of benign tumor under the nail. One of the most recalcitrant tumors for treatment. Deep tumor, surgical tumor cannot remove it completely. We doing QuadroStarPRO 4 to 6 sessions by 1 mm spot size, expert mode, but repeated session. We take multiple passes every one. The tumor complete improvement after 4 to 6 sessions and leave only this crustacean only. Joules used from 23 to 28 joules per square centimeter. This is an example of tumor can be treated by QuadroStarPRO by surgical mode or 1 mm spot size mode. Our conclusion. Why QuadroStarPRO laser? What's the benefit from this machine? This machine has a unique wavelength, 577 nanometer. This wavelength can be supplied for many dermatological disease, some vascular, some pigmentary, some tumor. So range of dermatological disease, wide range of dermatological disease can be treated by QuadroStarPRO. Also, QuadroStarPRO can compensate other machines. As we know, hyperpigmentation can treat by 532. You can use it QuadroStarPRO. 1064 in the egg can treat acne. We can treat it by QuadroStarPRO. IPL is a beneficial in rosacea and telangiectasia. Also, QuadroStarPRO can act. So it's considered multi-machines can perform the function of different machines alone. One of the most important advantage of QuadroStarPRO that has no consumers. As we know, pulsed dye is a famous machine, but need dye every few months. This increases the cost on the patient. QuadroStarPRO, we have it from 5 years or more. We didn't do anything for the machine. It's working from more than 5 years without any consumers. So this will minimize the risk of the economic factor on the patient. And with this result, I think it's considered the standard machine for vascular laser and dermatological disease. Thank you and stay healthy.
Okay, this was very interesting. Thank you very much, Professor Essam, for your presentation. And I think it was a very wide range of different indications. Actually, we did this in 1 hour, in a 1 hour time. We already had some questions, but I see also some more questions here. And please allow me to select some of the questions. There are a lot. And I repeat again, we will, I think, present this webinar also in the net so that we have the chance to listen them again. There were some questions here, or there are some questions in the table which Professor already answered, and I just want to select some of the questions here, and maybe you can give the answer. Tracy Chua said, if we just do not do open pen, do the pen mode and just the scanner mode, will be there any difference in the efficiency of the treatment? Can you answer this? Is there any difference in the efficiency of pen mode or scanning mode?
1 millimeter spot size mode used for selected lesion. If you have single telangiectasia, a small sized lesion, you can use 1 millimeter spot size mode. If you have diffuse lesion, large lesion, diffuse telangiectasia, port wine stain, acne, and so on, you cannot use 1 millimeter. You must use scanner. So 1 millimeter localized lesion, scanner mode, diffuse lesion.
Okay. Vanny asked how to avoid the risk of hypopigmentation after the treatment.
Again.
How do you avoid the risk of hypopigmentation?
There is no hypopigmentation in QuadroStarPRO. One important item for user QuadroStarPRO, you must select the fluence according to the site of the lesion. If you have lesion here, or lesion here, or lesion here, here in the face, you select the optimal fluence. If you treat this lesion with 20, you select 20. The same lesion here, you must reduce the fluence about 25%. Here you can act by 15 or 16. Here you must reduce it more. For example, if there's a post-wine stain in the face, in the cheek, forehead, and the neck. In the cheek, we start by 18, 19 joules. In the neck, you must decrease it to 15. In the forehead, you must decrease it to 14. So every site and every region has the same, has a unique fluence. Hypopigmentation will never occur in QuadroStarPRO treatment. Hyperpigmentation can occur if you increase the fluence above the level used in this site or in this lesion. Okay.
Okay. Then another question from Nani. For port wine stains, how long is the duration in between session? But I think you mentioned this already.
1 month. You can use in port wine stain. More than 6 sessions is needed. 1 month interval.
Okay.
In some lesion like acne, like facial erythema, you can do the session every 2 weeks.
Okay. Then Christopher asked, Professor Essam, do you have a specific technique when you apply the scanner on the skin for your treatments? I mean, specifically with a scanner.
No, just compression, light compression on the skin, and no overlap. You must remember that don't overlap over pulses. You do the pulse without overlap, light pressure only on the skin.
Okay. Brandon asked, do you use Pro Yellow laser for facial rejuvenation? If yes, please explain your technique.
Really, I didn't use it for facial rejuvenation. I was working in hospital center, not in cosmetic center. But if we treat telangiectasia, if we treat hyperpigmentation, you can treat all. For my opinion, if you want to do facial rejuvenation, it's better to use scanner mode, use low pulse fluence, low fluence like 14, and short pulse duration like 26, 28. I think it will give a better results.
Okay. Canon asked even, do you combine any other treatment for melasma treatment? But you mentioned this also with the chemicals, or also do you apply maybe a Q-switch laser or something else? Is it also an opportunity?
We answered this before, but we can say that QuadroStarPRO is addition to treatment. Treatment of melasma, mainly hydroquinone. You can add QuadroStarPRO to improve to increase the improvement, and the most important item, to minimize the recurrence. Medical treatment alone associated with high rate of recurrence up to 100%. If you add QuadroStarPRO, you will minimize the rate of recurrence.
Okay. Another question comes from Lunardi. Good day, Professor. Do you also use Pro Yellow for hypertrophic scar? And if yes, may I know what parameters do you use?
We have, thanks for this excellent question. We already act on hypertrophic scar, and the result satisfactory. But when completed, I will show it, especially post-surgical scar.
Okay. Lem asked, hi, Professor, you mentioned about what really important with the melasma. Would you please repeat that? Because melasma is a topic in Singapore, Malaysia, and also the country Indonesia. And maybe you can pinpoint just in few words again, is it okay for melasma, and what do you like specifically regarding this treatment?
As regards melasma is a cosmetic problem. The first line of treatment is medical treatment, hydroquinone and so on. If medical treatment fails, you can use vascular treatment or laser treatment. Laser has two main pools. The first pool is pigmentary laser, which is treated melasma but didn't avoid recurrence. The other pool, which is vascular laser, which improve or minimize the recurrence rate of melasma. From my opinion, it's better to start with medical treatment in addition to vascular treatment, vascular laser. 3 months will give significant improvement. Then continue on vascular laser to avoid recurrence. Every 2 to 3 months will prevent recurrence or minimize the recurrence.
Okay. Yes, this is all the time the message what I also learned from you. And actually, if I'm underway with the professor, he joined us already 2 times in other countries. I'm also very happy to see that he really, it seems that the professor liked the machine and he's really using the machine, and we very appreciate this. I have another question. Hi, Professor Essam. You mentioned using Pro Yellow laser for treat acne. May I ask how exactly you do the treatment? How many passes? What is your treatment endpoint? And I think you mentioned this already, but maybe you can highlight this again.
In acne?
Acne, yes.
Yes. Acne vulgaris is one of the most effective treatment, effective option is QuadroStarPRO. In our study, this undergone publication 2 days. We use babulobascular acne and neurocystic acne, or what's called inflammatory acne. The result in babulobascular is good, but the result in neurocystic is satisfactory and highly excellent. Why? Papillobacter can be treated by other ways, like antibiotics, like isotretinoin, and so on. Pseudocystic is resistant to medical treatment, so the laser is the first option. If the patient contraindicated isotretinoin, has no hope except laser. How to treat acne with QuadroStarPRO? 3 sessions, 2 weeks interval, scanner mode, single pass. Start by fluence 18 and increase according to skin type. Don't exceed 21, but take care. Forehead, you must decrease the fluence. Acne is a common problem in the forehead. If you act on the cheek by 18, 19, you must act on the forehead by 14. 80% coverage, pulse duration from 28 to 32 according to skin type. This is the excellent parameter for satisfactory treatment for acne. And the result was highly excellent in acne disease.
Thank you very much. I have some more notes here. Actually, it's not in the direction here in Europe, Africa, Middle East. It also the greetings come from Gloriana from Costa Rica. So you are somewhere in Americans. So it's interesting that they are joining us. Thank you very much. Cindy has also a question. May I know, and I think this is also important, may I know what is the pre and post care? Maybe you can say some things there.
What is, sorry, pre and post?
Pre-treatment and post-treatment care for the skin.
It's a good question. Thanks. Pre-treatment, as we know, 577 nanometer acting oxyhemoglobin and melanin. So there is a competition between oxyhemoglobin and melanin on the wavelengths, on the fluence. To improve the efficacy, you must use sunscreen, depigmented agent for skin for dark skin type 1 month before treatment to decrease melanin content in the skin, and most of the light were absorbed by oxyhemoglobin. Post treatment is just emollient and sunscreen only.
Okay, so I think we passed already a lot of questions. Yes, there are some more. Maybe I take one more, which was similar to the question before. However, I think this is a modern style and a modern device, also pico laser. Mr. Howard, Dr. Howard asked, would you recommend using Pro Yellow with a pico laser and I add Pico Star for melasma treatment? How would be the sequence?
Pro Yellow was pico laser.
I mean, if you use the Pro Yellow in combination with picosecond laser, and of course he said picosecond and I say from the company Pico Star for melasma treatment as a combination.
You can use it every 2 weeks, 1 session Pro Yellow and 1 session pico laser, but not in combination the same session. Also in the eyelid, the absorption power is high, so must use the low fluence, and it's better to use contact shield on the cornea to avoid corneal injury by laser.
Okay, so then I think we want to not to extend it too much. Again, I see some more questions, but most of them were answered, and I kindly ask the participants to send the questions to us. We will check maybe we can answer. However, we are in the daily and weekly contact with Professor, and we can ask for these answers from him, and we want to answer you. As I mentioned, the presentation will be also, I think, in the net. My colleagues will put this, and there are also some other webinars are coming up. I know this internally. And again, we were 280 participants. Now the number is going down a little bit because we come to the end. Again, thank you, Professor Essam. It was my pleasure to see you even here in this difficult time. And I'm sure we will do something more together as well. I say thank you to the other ladies and gentlemen here in the webinar. Let's do it again as we can arrange this. And maybe we can even go then deeper in preparation of your questions. And if you sent the questions before, maybe we can specifically come back to this question in the next webinar. Send it to us, mark it as a maybe as a new webinar request, and then I think we can answer right away, and this can meet also the other participants here in the field. Thank you very much. 187. Have a nice day and stay healthy. Thank you.
Thank you. Thank you, my dear friend, and stay very healthy. Thank you for Asclepion company. Thank you for all colleagues.
It's our pleasure. See you next time.
Goodbye.
Thank you.